Did you know that 83% of all South Africans are not on a medical aid? And that 8% of our GDP goes towards medical expenses, of which 50% is contributed by the 9 million people that are on a medical aid, and the other 50% is contributed by the 51 million people that are not on a medical aid. The NHI has made headlines recently after it's been published in Parliament. But what is it and how does it affect you? Well, I'm Kobus Kühn and I'm a certified financial planner, and today I'm going to try to simplify it. Here's 11 things you need to know about the NHI and how does it affect you. Enjoy! Much has been speculated about the NHI, but there's a lot of uncertainties. So what is it? In short, government want to provide free medical cover for all South Africans. They want to set up a national health insurance, which is in essence a huge state-owned medical aid. Number 2, will you have a choice to belong to the NHI or can you have your own medical aid? Nope, it's going to be compulsory for everyone. Medical aids as we know it will most probably disappear or change a lot. Your medical aid will only be able to provide you with complementary cover. This means your medical aid won't be able to cover you for those services already covered by the NHI. Number 3, who'll pay for it? Well, you guessed it, it's going to be the taxpayer. It's estimated that approximately 3.5% to 5% of your income will go towards the NHI. Number 4, what will it cover? Well, the bill doesn't really specify this, but it does say comprehensive healthcare services. A benefit advisory committee will be appointed by the Minister of Health to determine what these services will be. But the fund will only cover treatment that is medically necessary. Number 5 is how much will government pay for these services? Government will determine on a yearly basis what price they'll pay for these services delivered. In other words, if you're a medical professional, you will no longer be able to determine your own fees. Number 6, who will be your GP? This is not very clear, but it looks like you'll need to register with a GP in your area, and that GP can only have a limited amount of patients. You will also be limited to the amount of times you can see your GP. Number 7, can you go to a specialist directly? Well, no, you won't be able to go to a specialist directly. You'll have to be referred by your GP. And it does seem that everyone will have access to private sector specialists. Number 8, what about medical aids? Well, as previously mentioned, your medical aid won't be able to cover you for services already covered by the NHI. My guess is that things like top-up cover or things like medical insurance might become more popular. But this is something that I'm not sure about, so we'll have to see. Number 9, what about adult asylum seekers or illegal foreigners? They will only have cover for medical emergencies and cover for things that is of the public's health concern. Children of adult asylum seekers and illegal foreigners does look like they will have cover to basic health services. Number 10 is what about your medical records? You'll have full access to your medical records that is kept by the NHI. And lastly, number 11 is who will run the show. A CEO will be appointed along with 11 board members that is appointed by the Minister of Health. They will only be able to serve a maximum of 10 years. So that's maybe not a bad thing. Well, we've all seen how amazing this has worked out in the past. If we look at Eskom and SAA, and the list goes on. They want this show to be up and running by 2026. I'm not sure this is going to be the case, but we'll have to see. Let me know in the comment section below what you think about the NHI. Do you think this is something that will actually work? Are you excited about it? I hope that you enjoyed this video, and if so, smash that like button, share it and subscribe. Otherwise, I'll see you soon.
Thank you!